Welcome to our presentation, Identifying and Managing Crisis. Group members are Brittany Badwin, Brandon Keller, Atalia Jeffries, Cynthia Rivera, and Carolyn Thomas. Crisis intervention's focus is to lead to an early resolution of acute stress disorders or crisis episodes while providing a turning point so that the individual is strengthened by the experience. A crisis or traumatic event can provide a danger or a warning signal, a challenge, or an opportunity to sharply reduce emotional pain and vulnerability. The ultimate goal of crisis intervention is to bolster an individual's current coping methods or help the individual reestablish coping and problem-solving abilities, while helping individuals take concrete steps toward managing their feelings and developing action plans. A crisis is defined as an acute disruption of psychological homeostasis in which one's usual coping mechanisms fail and there exists evidence of distress and functional impairment. The subjective reaction to a stressful life experience that compromises the individual's stability and ability to cope or function. A crisis intervention is defined as a focused short-term intervention seeking to resolve a crisis. The following are the principles of crisis intervention. Crisis intervention is time-limited and short-term. Engagement and assessment occur simultaneously and efficiently. A fundamental purpose of crisis intervention is to meet concrete and emotional needs through the provision of services. Crisis intervention must move quickly, seeking to help a client return to previous levels of functioning. An overarching theme of crisis intervention is it must be voluntary. The first example of a crisis theory is working with a family during a time like this can be challenging because they are often unable to comprehend what has actually happened with regards to the death of a child or a child relative. Crisis theory can be used in many settings, but it is important to make sure that the setting is appropriate and beneficial to the client's healing and positive forward progression. Unfortunately, most of those that have been placed in housing or some type of residential setting have been inpatient in a psychiatric hospital prior. This could become somewhat of a revolving door type of situation. In residential settings like that of group homes, there are trained staff that are prepared to respond to a crisis at a moment's notice. This will allow for a possible de-escalation of the situation and deter from hospitalization. Hospitalizations can be traumatic even for those that are familiar to them. For example, being taken from a stated feeling of stable and content to being placed in a restricted environment. There are many mental health advocacy services that are willing to review, educate, and/or treat crisis. This is not exclusive to strictly adults. Mental Health First Aid, SAMHSA's, NAMI, or even local outpatient mental health clinics cater to these types of trainings. There is a great need for education on mental health, mental illness, self-care, and crisis. Crisis does not discriminate. Robert's 7 stages guide social workers from the assessment, which is usually effectively and efficiently combined with establishing relationship stage to encourage collaboration and secure willingness from the client. Crisis theory interventions are promptly implemented. Crisis is a subjective concept and is defined by the person, family, or community experiencing the crisis. For this reason, crisis theory interventions can be used with individuals, families, and communities experiencing their defined crisis. Social workers acting as change agents in a crisis can explore the client's feelings and explore solutions. Crisis theory interventions are driven by client perspective of crisis. The stages can be advanced in various orders and used to meet numerous needs. Furthermore, the swift application of crisis theory interventions affords social workers the opportunity to infuse the supportive process with a practice theory. The desired goal of implementing a crisis theory intervention is to propel the client not just towards equilibrium, but allow them to grow during the process. Working through a crisis can result in an emotional experience for clients. It is essential to consider the client's emotional state and the competence and attitude of the social workers so not to re-traumatize clients during the process. Crisis events are universal and considered short-term. However, the exposure to them and the vulnerability to their effectiveness varies. Crisis theory lacks the discussion of primary health care it deserves. Traumatic events should be understood through the cultural and social context that it occurs. From a traditional approach to the crisis, it is assumed that the day-to-day experiences is safe and stable. In the early work of crisis theory, the metaphor of a stable structural model of the system and that a crisis is an imbalance and a threat to steady state is used. This traditional approach leads to practitioners attempting to manage the risks rather than finding opportunities to change. Because different models of crisis theories are used, measuring the effectiveness of the intervention is difficult. Working with clients in crisis requires intentionality and establishing emotional boundaries so that social workers can respond appropriately to stressful events in their clients' lives. It is vital that the social worker is deliberate in utilizing strategies that support self-care. Thank you for watching our presentation.